At the state capitol, Governor Malloy is on the attack tonight. He is fired up about hospitals here in our state.
Yeah, he says they make big money and should have no problem absorbing cuts to the state budget. But since those cuts were announced last week, the hospitals have been complaining. Tonight, Chief Capitol correspondent Mark Davis joins us live with how Governor Malloy is now responding. Mark?
Hi, Aaron and Darren. Good evening, everyone from the Hartford newsroom. For the past week, Governor Malloy has let a spokesperson in his office go after the hospitals, but today he decided to do it himself. Governor Malloy's verbal blast at the hospitals coming 10 days after he announced cuts to Medicaid of about $60 million. The CEOs of some of the hospitals have said that because the funds they get from the state are matched by the federal government, it's actually a much bigger cut and could affect services and cause layoffs. But the governor says the hospitals and their other businesses had big profits last year and can't afford it.
I think the public should know that a not-for-profit or a series of not-for-profits have a total amassed wealth in a single year of $919 million.
The governor also noting that only 3 of the state's hospitals had no profits last year, and the hospitals as a group had profits in the 5 to 6% range every year for the past 3.
You can't be serious in the state of Connecticut about cutting expenditures if you're not willing to put everything on the table.
The governor's office has been pointing to the high 6- and 7-figure salaries of hospital chief executives as an indication they are not holding the line on spending, a claim that has been called a red herring by some. He singled out Yale New Haven in particular, since it's been reported the CEO there is making more than $3 million a year.
Pointing a finger at the state and say, and by the way, you should give us hundreds of millions of dollars more, I don't think there is anything such as a red herring.
In reaction to this, Yale New Haven Healthcare VP of Public Affairs Vin Petrini says in part, quote, the state severely underpays hospitals. In addition, the state now heavily taxes these nonprofits. Executive compensation has no impact on the issue at stake here. Now, you can read the entire statement from Yale New Haven Healthcare by coming to our website, WTNH.com, and clicking on this story. Live from the Hartford newsroom, Mark Davis, News 8.